In this video, I'm going to be talking about generalized anxiety disorder and everything to know about it and information to teach you about things you may not have known about this disorder or may already know, but also providing examples, backing up what I'm going to say with research articles, review articles, and web pages I have found. Generalized anxiety disorder is very important for people to know because you never know if you may know someone that has it, or you could possibly have this disorder and maybe not realize it and you think it's something normal that you have. I'm making this video also to just teach you about generalized anxiety disorder in like the easiest way possible. First, let's just get into more of like the typical definition of generalized anxiety disorder. Generalized anxiety disorder is when someone experiences anxiousness or a constant worry, honestly, at any point of their life. This could be things like work, school, doing little simple tasks, socializing with people, and much more. This disorder really impacts someone's life where it could cause you to avoid situations where your anxiety gets really bad. Like this could be like maybe avoiding school because you get really bad anxiety, or it could be avoiding events where you have to socialize with other people, and you may get anxiety because you're always having that feeling of like being scared in a way, and you want to avoid that because having anxiety is not a good feeling to have. It's not like being shy or nervous. It's very much more severe and worse. I would say this disorder causes people to stop doing certain things that they would want to do but can't because of this disorder. I would say like interviewing for jobs or doing internships, because they have so much anxiety built up of going out to do that they will stop themselves just to avoid that feeling. Now I'm going to be listing the general symptoms of generalized anxiety disorder. People with generalized anxiety disorder don't always have all these symptoms, but these are the most common symptoms of generalized anxiety disorder, so I'm going to list them down. These symptoms can be excessive sweating, even though you may be in a room filled with cold AC, or you're not doing any physical activity, but you are sweating, or you are overheating because you're so anxious. And also your heart rate might be going up with anxiety. This is like a really common symptom, I would say. Heart rate increase with anxiety. I would say shaking is also a really big one. For example, say you are giving a presentation and you're really having bad anxiety. You're not shy or nervous to give the presentation, but you just naturally have the anxiety for any little thing you do. So when you're presenting, since you're shaking, your hands might be really shaking, or your voice might also be very shaky. Another one is a loss of memory. This, for example, could be like, say if you're going to go take an exam, you're super anxious, your anxiety is off the roof. This can cause you to just blank out, and because you're so anxious for the test, it could possibly cause you to forget things that you learned for the exam. Another symptom is headaches, which anxiety also leads to stress, and when you're always feeling really worried, sometimes that could be really hard for your brain, and that possibly can cause headaches to happen. Another symptom is always feeling uptight, never feeling calm. Another one is unable to sleep regularly. You're so anxious and you're staying up all night because there's something on your mind, and you are just unable to fall asleep because of this. I would say another symptom of anxiety is just always like thinking back to like negative events or memories. I would say because usually people with generalized anxiety disorder tend to always just look back on memories that they regret or feel like that were embarrassing, if that makes sense, compared to looking back at like the positive memories that they have. They always tend to look back at the memories that were most embarrassing, and going back and looking back at those memories also causes anxiety in that person. I listed some of the basic symptoms for generalized anxiety disorder. Now I'm going to be talking about the treatments. The most basic type of treatments are either medication and psychotherapy. So like meditation or talking to a therapist would count as psychotherapy. And then common types of medication for generalized anxiety disorder are antidepressants, SSRIs and benzodiazepines. I'm not sure if I'm saying that right. And you may be wondering, why is it important for me to learn about generalized anxiety disorder even if I may not even have it? I like to say generalized anxiety disorder is so important to understand, and here is why. Generalized anxiety disorder affects many people's lives and you may not even know it. You may think, how bad could it be? They're just a little nervous, but that's actually not true. It has been shown in many articles that generalized anxiety disorder can impact someone's life so much you don't even know. It could also affect the way that people think of things and just the way they move around life. Like I've said before, this disorder has caused people to turn away important events in their life just because of this disorder consuming them. I'm going to be using a review article by Elizabeth H., which is generalized anxiety disorder, and use some things I've learned from this article and explain it to you guys. This article talks about how people's lives are interfered with anxiety, but it also talks about how underlooked generalized anxiety disorder is in healthcare. And I feel like this is so insane because I feel like people think it's not that severe when really it is, and it shouldn't be underestimated because it's not as bad as many other things, but it just is as bad. I will give like a brief example of this disorder. Say you really want to join this club on campus and stuff, but you're feeling very anxious about talking to people you don't know, and to the point where it's over consuming you, that you like are having this feeling of anxious that you're gonna be embarrassed or just like you're not gonna do something right, and this will cause you to not want to go. And this can be also added to like future like events, like say getting like a big job, but you don't want to go through that interview, you don't want to accidentally embarrass yourself, you have negative thoughts in your head saying, what if I'm not good enough, or what if like I embarrass myself, like, you know, and this anxiety makes negative minds in your thoughts and just gives every wrong outcome ever in your mind, where you decided to let that job interview down because you just don't want to face your anxiety. Obviously, the person doing this does not want to turn their job down, but it's because how bad and severe their anxiety is, they unfortunately do so. And just because this information I'm giving you may not apply to you, this could apply to other people you may know that are secretly suffering with generalized anxiety disorder and may need help. It's very important to know this type of information for this disorder, especially because it's also very common. Now I'm going to be including a webpage which I have found from Mayo Clinic, which talks about generalized anxiety disorder. The main thing I wanted to point out from this webpage is the risks of having generalized anxiety disorder and not seeking help for it. These risks include an increased chance of developing depression, also having decreases in energy, not be able to focus a lot. This also can lead to digestive problems, migraines, which I discussed before, but also this can lead to heart problems and health problems. And I'm just saying, this disorder going all the way to cause health and heart problems should be motivation for you to want to know this information and have a better definition of what this disorder even is. Going on with this information, I would also like to add that only 1 out of 4 people with this disorder actually get treated. And what this means is that majority of people with generalized anxiety disorder don't reach out for help, which is not good. And I'm getting this information from another webpage I found, which it's called World Health Organizations. And some reasons that some people with disorder may not reach out, or you're wondering why don't they reach out. People with disorder have anxiety. They have anxiety with any little thing that they do. So this even means reaching out to help for their disorder. They are scared that maybe they're not qualified enough, or maybe they don't think their disorder or anxiety is that bad to go reach out for help. They also may think that getting treated for their disorder might make their anxiety worse, even though that's not the case. It's just the effect of anxiety in your mind, where it's trying to tell you that if you go reach out for help, it's not going to work. But that is not true. Now I'm going to move on and talk about primary research articles that I have found and the studies. Generalized anxiety disorder can be tested to see if there's a huge impact on people with this disorder and people without this disorder. There was a study that was conducted where to see if there was really a huge difference between people without anxiety disorder and people with anxiety disorder. I am using a research article by Hennings. This is called Impairment and Quality Life in Individuals with Generalized Anxiety Disorder. The study is pretty much about better life satisfaction. So if people with generalized anxiety have maybe a better life satisfaction than those without the anxiety disorder, or if those with the disorder have a less satisfaction with their life compared to people without the disorder. Some of the things that the study used was like self-esteem, work, family, finances, and other things. This study contained 107 participants. 52 of the participants have generalized anxiety disorder and 55 participants had no generalized anxiety disorder. Also, as of gender-wise, participants were mixed with males and females. So now we're going to be talking, how did they do this study? How did they come up with this information on how to do a study like this? I'm going to tell you what they did. So each participant in the study was given a packet to their house, and they pretty much had to complete it themselves. And it was a questionnaire packet, and it would contain questions like certain events and like if you get anxious. These questions were rated on a 0 to 4 scale, 0 meaning that you do not correlate with this question that they're asking, and 4 meaning you really relate to this question that they're asking. I'm going to provide the chart. As you can see, people with no disorder had better self-esteem, work, goals and values, finances, creativity, love, friends, and relatives were significantly higher and had a better satisfactory life than those with generalized anxiety disorder. The two main topics where people with disorder were mainly having a low self-esteem with life or a low satisfactory with life was with work and their self-esteem. For every other topic, they did have positive life satisfactory, but they were very, very low compared to the people without this disorder. As you can see, people that didn't have this disorder had a better life satisfactory. It was really a huge difference in this study compared to the people with this generalized anxiety disorder. And you may be wondering why they have a worse life satisfactory with self-esteem and work. And this because being at work, sometimes you are stressed out, or maybe you are just like anxious being there because of the environment. It's not an environment you may know and love, or you may not be familiar with. And self-esteem, the reason why there's such a low self-esteem in this data is because your anxiety is your self-esteem, and your anxiety is pushing down your self-esteem because your anxiety controls your body. With people with this disorder, it affects the way you think and handle situations. It makes you wonder more negative thoughts in your brain than positive thoughts. And so maybe when you're at work, you always have that negative mind and you always feel embarrassed. You always feel like you don't belong or you're doing something wrong. And unfortunately, that's what people with this disorder think and feel. People with this disorder have low self-esteem just because of their anxiety. They don't feel confident in themselves because your anxiety, makes you feel embarrassed even when there's nothing to be embarrassed about. I will say in the study, people with this disorder did have a good life satisfactory with friends and relatives, and I'm going to tell you why, because you might think that doesn't make sense, but it really does. People with anxiety love to do things that comfort them to avoid having that feeling of anxiety, and this could be having friends that you know really well and trust and you're comfortable with, and this reduces your anxiety. Just like your family, when you're being around family who you've known since you were born, you're very comfortable around them. You don't feel embarrassed around them because they know you and you don't see them as a negative or someone who would embarrass you, and also just because these are people that you trust more, which is why they're your friends and your family. And so overall, my conclusion with this is that generalized anxiety wouldn't be bad if it didn't affect our lives as much as it actually did, but unfortunately it does, which is why it's always good to seek help if you are feeling symptoms of anxiety and it's really taking a part of your life and making you not want to go do things or taking away things that you love. And obviously, as you could see from the study that I presented to you guys, that people with this disorder have a huge life impact compared to people without this disorder. And it's so sad because no one was asked to give anxiety to themselves. No one wants to have anxiety. It's the worst feeling I can imagine. And if you're someone who is feeling like you may have this disorder or someone you know may have this disorder, please talk to them. Or if you're someone that you think may have it, please reach out for help. Don't be scared to ask for help because it's always there. And I hope this video increases your knowledge of generalized anxiety disorder and that you now have a better understanding.